Welcome. I am Dr. Simone Charles. I'm a clinical associate faculty in the Department of Environmental Health Sciences and as well as the associate chair for the department. When we think about environmental exposures, they always have impact and it impacts somewhere. And oftentimes that impact is at the local level. A student should enroll in this if you are interested in addressing any of the environmental issues that exist within communities. We will look at biological, chemical, and other exposures, the effects and extent of these exposures, what their impacts are on human health, their mitigation and management of those exposures, specifically infectious disease, and then how the risk of exposure can be assessed and managed. The skill set, it's very broad. You'll go all the way from understanding, evaluating, to actually using the information to then make change. To understand environmental health and be able to address some of these, we have to kind of understand environmental racism. It gives context to what we're seeing in communities today. When we think about racism, we think about the institutional, systemic, historical practices or historical or current practices that impact communities of color. When we think now of environmental racism, we think about how those very historical or current practices impact the environment or the lived space of people where they live, work, play, and pray, learn, and how it impacts their live space and the things to which they're exposed to in their live space. And so environmental racism brings those two worlds together. Several of the circumstances that still exist today, some of that drive health disparities are still showing up in some of these communities. This certificate is quite unique in that it focuses on some of the pillars of environmental health, looking at exposure science, toxicology, infectious disease, and risk assessment, some major pillars, but we're looking at it from a unique perspective that we are focusing on racism as the historical context or current day context, and understanding how to take that science and apply it at the local level. It's important that we train all practitioners, all public health practitioners, in understanding how environment impacts health. Because let's face it, most people don't recognize that over 25% of all disease has an environmental link, right? And I think that number might be even be higher. And so anyone who's interested in how the environment or how their lived space impacts health and then wants to do something about it is great for this certificate.